Y'all know there is no topic with me.
Good morning. My name is Sarah Fossoltz. I serve as the board administrator for the Texas State Board of Examiners of Marriage and Family Therapists. I'd like to begin with calling the roll. Chair Merchant.
Present.
Dr. Barty.
Present.
Dr. Elder.
Present.
Mr. Francis.
Present.
Mrs. Husband Thompson relayed that she could not attend. Mr. Parrish.
Present.
Pastor Skoma.
Present.
Ms. Smith relayed that she could not attend. Chaplain Stoglin.
I'm here.
And we have a quorum. I turn it over to Chair Merchant.
Okay, welcome everybody to our January meeting of the Texas State Board of Examiners of Marriage and Family Therapists. I'm so grateful for all of our board members who are here, and I'm grateful for the public who is tuning in. So we are going to begin our meeting with a approval of minutes from our October 21st meeting. Board members, have y'all had an opportunity to review those minutes? Okay, is there any discussion about those minutes? Okay. If not, would somebody like to make a motion? Okay, Russ makes, or Dr. Barty makes the motion. Is there a second? That's Chaplain Stoglin. All those in favor of accepting the minutes, raise their hand. Okay, that is unanimous. Okay, moving on to agenda item number 2. We have board review and possible action regarding appeals of application. There were none, so we're going to move past agenda item number 3. Same with agenda item number 4, board review and possible action regarding agreed orders. There are also none of those. Likewise, there is nothing for agenda item number 5, which is board review and possible action regarding contested cases from the State Office of Administrative Hearings. So that puts us to agenda item number 6, which is report of agreed orders executed by the council's executive director. Is there any discussion over agenda item number 6? Okay, then do we just move to accept that, or can we just accept, do we move to accept that report? Do we have to vote, or can we just accept it? Or just move on?
You don't have to vote.
Okay, yeah, so okay. Okay, we're moving on from agenda item number 6. So that puts us at agenda item number 7, report of cases dismissed by the council's executive director. There is a report in your board packet. Is there any conversation or discussion over agenda item number 7? Yes, Dr. Elder.
I just had a quick question. I see that item number 10 was untimely was the reason for dismissal, and I'm just not familiar, I guess, with that term. I'd like to understand it.
Sure, there's a rule about, it's a rule of limitations, and essentially if a case alleges sexual misconduct, it has to be filed with the agency between 7 years of the last date of service and the date of filing. So I don't know what the date of this particular one, but essentially it was more than 7 years from the last time the person provided services to that person to filing it with us. And so that's just the general rule. It's generally 5, except for sexual misconduct is 7. There's an extra 2 years.
Is that in statute or rule?
It's in the BHEC rules. And it's done to mirror the requirement for records retention.
Oh, that makes sense. I mean, clinically, I'm thinking it can take years to report abuse, particularly sexual abuse. And so for me, the statute of limitations at 7 years seems a bit short, but at the same time, you know, without records, there's no way that clinician can defend themselves. That makes sense. Thank you for that explanation.
Right.
Jody, I'll just say that when this change first happened, I was kind of had the same reaction where I was like, I don't like this. But then again, it comes down to that record retention. So
thank you.
Okay, any other discussion about agenda item number 7? Okay, then we will move on to agenda item number 8, which is a status report of quarterly enforcement activities. Is there any discussion over agenda item number 8? If not, I will just add that I love that MFT is down to only 25 open cases.
Agreed.
Just to see how much work they have done to reduce the number of open cases, to me, is just spectacular. And so I'm just incredibly proud of just how hard everybody's been working to close out those cases, so. Okay. Okay, then moving on to agenda item number 9, report of compliance with agreed orders. Is there any discussion of agenda item number 9? Yes, Dr. Elder.
And just really quickly, item number 3 on this list, it looks like the deadline for submission of the required elements has passed. And so I'm wondering if that would be moved on to the next step.
Yes, staff would take the appropriate action. And we've had this discussion before because it remains confusing, but if a person is alleged to be not in compliance with an order, a new complaint is opened,
Mhm.
but there's a confidentiality about
Oh.
that. So we don't put that on your report,
Sure.
but staff is on it and they've taken the appropriate action. But thank you for your attention to those details.
Sure. Well, I had forgotten that discussion. Thank you. I appreciate that.
Any additional conversation about agenda item number 9? Okay, then we will move on to agenda item number 10, which is discussion and possible action to re-elect or replace the public member delegate to the Texas Behavioral Executive Council. So Mr. Francis has been serving in that capacity and doing an absolutely tremendous job representing the board at BHEC. Sadly, Mr. Francis, his tenure on the board is nearly up. Technically, his tenure ends on February 1st of 2023, so just in a few days. However, we have not had news from the appointments office regarding when his replacement is going to be appointed. And so consequently, he will continue to serve until that replacement happens. But we don't know when that's going to happen. It could happen next week. It could happen a year from now. So just in preparation, Mr. Francis and I had a conversation and we decided it would probably be better for him to go ahead and step down as the delegate to the BHEC board, simply because we don't know when he is going to be replaced. And so consequently, we can open the floor for nominations. Mr. Francis?
Madam Chair, that position needs to be replaced by a public member, and I would make a nomination to replace it with Dr. Skoma, and that would be effective immediately.
Okay. Do we have to second the nomination or do we just, okay, can I have a second? Well, first, we do have some seconds. Dr. Skoma, would you be even willing to accept this nomination? You're muted.
Oh, you unmuted me and then I muted myself. Yes, after the, I think it was 6 or 7 hours you gave me to consider yesterday. In prayer and consideration, yes, I would be willing to serve if that was the board's decision or will.
Okay. Do we have any other
I
discussion?
would need though to step down. I think I would need to step down from the ethics chair to make room for that.
Yes, sir.
That would be acceptable.
Yes. Okay.
Thank you, Dr. Skoma, for your willingness to serve in that capacity.
Yes.
Do we have any
We
other?
haven't voted yet, so you can thank it.
Do we have any other discussion or nominations? Okay, then let's take a vote. If you're in favor of appointing Pastor Skoma to the BHEC board, please raise your hand.
I'm
Okay, that is
abstaining.
unanimous. So Dr. Skoma, you are hereby elected.
All right.
Their
I would
first
like to, two things, if Mr. Francis and I, if he'd be willing to get together with me and give me some tutorials, that would be wonderful.
Of course.
And I would like to be known on that board. I'll take on the name of George V, if that's all right.
We
Kind
might
of like
have to
Charles
move
V
you-
did. We'll do,
we might have to move you to George VI. There's already a G5. He's
oh, there's a
scheming.
G5, so we can, that's fine. Okay.
Okay, so let's see here. Thank you, Pastor Skoma, for just your willingness to step into that position. Sarah, can you make sure that Pastor Skoma knows when the next meetings are? I do believe there's one in February that's coming up.
The next council meeting is January 31st.
Oh, January
Will
31st.
Mr. Francis be attending that, or do you, do we intend Reverend Dr. Skoma to attend? Mr. Francis is nodding yes, and it was an or question, so I'm not sure what the affirmative is.
Oh, you missed the first shake. No, Mr.
Oh.
Francis will not be attending that. And yes, Dr. Skoma will be attending that.
Okay. So I'll ask Ms. Skiff to make sure that Pastor Skoma has council materials available to him. That agenda has been posted, I believe, on our public website, and I'll send you some more emails, Reverend Dr. Skoma, after this meeting.
And Sarah, I just let Daryl know, so he's aware of it.
Thank you.
Okay, if there's no other discussion of agenda item number 10,
Wait. I just want to say, I don't know if this is really our last chance to publicly thank Mr. Francis for his service in case he rolls off, but George, you have just been such an invaluable part of this team for all of the years of your service, and you will be greatly missed. And just, there cannot be enough thank you said for your hard work and all the expertise that you brought to the team. Thank you for your service.
That is.
Bravo,
overtime.
bravo.
And
Absolutely.
I'm committing to sin by enjoying your comments, but thank you very much for it.
There's no sin in enjoying the truth. And that is true. You have been an anchor to this
Amen.
board. I've been on here a number of years, and when I came on as a young pup, you really helped me. And I remember some of our meals we've had together and just discussions. And so thank you for your dedicated service to this state and this board, and to our marriage and family therapy counselors.
It's truly
We will
been a
miss you.
pleasure and an honor. So thank you very much. And
I
thank
will,
you.
at the next meeting, I will wear a bow tie to the BHEC meeting in your honor. I make you that. pledge.
Whoa.
You watch and see.
I will. We'll be good. Thank you, folks. I do appreciate that.
thank you, Dr. Elder. Okay, moving on to agenda item number 11. This is our committee reports. So our first committee report is from Reverend Dr. Skoma for the Ethics Committee.
All right, we did have a meeting on January the 9th, attended by our committee members and staff and legal counsel. And once again, for the benefit of those tuning in, this is something we've been doing for, I guess, about a year now, where we, as a committee, take a look at the most, how do we say, egregious cases that were on the docket, the things that affected potentially the licensure of our practitioners, and just to have some other eyes on them, and for the education of the committee. And it was, we read through 10 cases, and the staff was very helpful, in the legal team, and it's very informative. I don't know who the next chairperson will be, but I would recommend continuing it. I think it gives value to us and to the state of Texas. So thank you to the staff for giving your time for us in that way. And yeah, everything's going very smoothly. Those few number of cases, we're seeing that on the back end. So great job, everybody.
Thank you, Reverend Dr. Skoma. Okay, next is the report from the Licensing Standards Committee Chair, and that would be me. We did not formally meet. I did approve one study plan this quarter. So a study plan is whenever somebody has not passed the exam after, I guess, their fourth, fifth, or sixth attempt, they have to submit a study plan. And so I did approve one of those over the, over the last quarter, but otherwise we have not met. And then next is the report from the Outreach Committee, which is also me. We did the December 2nd Lunch and Learn, and there are some information about that in your board packet. I am thrilled with the number of licensees who attended. And I don't know, I felt like it was a good conversation. I am super grateful for the other board members who were there and present and participated. And I don't know, I just felt like it was a really great opportunity. We will probably schedule another one of those, maybe it's over summer. I'm not sure that we have a set, like how often we want to do the lunch and learns. I think that it might be good just to kind of plan them whenever we've had quite a few like legislative changes. And so maybe this summer, after the legislative season is over, after we've already made some other legislative changes, maybe late summer, early fall might be a good time to do another one. So anyways, we'll just kind of play that by ear. Also, Ms. Smith has decided, or Ms. Smith has taken it upon herself to create like maybe something that we can put on our website that kind of delineates the difference between like a licensed professional and a life coach, as a way to just educate the public about kind of the difference. And so that is a task that she has taken on, and she is working on that. And hopefully we'll have something in the next few months to report to the board for y'all's approval. So any questions from me about, or discussion about the outreach committee? Okay, then moving on to agenda item number D, report from the Professional Development Committee. Ms. Husband-Thompson is not here to give that report. Sarah, do you have anything you want to say? I don't think they met, but Ms. Husband-Thompson did review a couple of things for you, I believe.
You're correct. The committee did not meet, but the chair, Mrs. Husband-Thompson, did perform committee function by reviewing some jurisprudence exam updates. And a copy of that was in the board materials. So the jurisprudence exam is up to date with current rules.
Okay. Is there any discussion over this item? Yes, Dr. Elder.
I just, again, want to reiterate my thanks to the staff for their diligence in making sure we're creating new questions to reflect new rules. It's a lot to keep up with, and these new questions are on point. Thank you.
Okay. Then we will move on to item number E, report from the Rules Committee. Mr. Francis.
We did not formally meet during this time period, but the new rules were posted. And Ms. Fossil, if there's anything that you want to speak about in regards to those rules being posted?
I think that's covered in the BHEC summary of actions, as well as the next few agenda items. Thank you.
Okay, is there any further discussion about agenda item 11D? Okay, then we will move on to agenda item number 12, which is discussion and possible action concerning public comment on the rules published in the Texas Register. This item is specifically about the supervisor requirements and setting some minimum standards for the 40-hour training. We did have one public comment, and there was a request to maybe amend the in the supervisor requirements. In the public comments, there was a request to about the LMFT supervisor. Right now, the way it's worded, only an LMFT supervisor can provide that 40-hour training. And so an LMSW had reached out and said that, you know, she would like to be able to continue to provide these trainings. And she had asked if we could maybe expand who can conduct those trainings. And so that might be something the board might want to consider. Do we want to expand this to maybe say licensees as opposed to LMF, or licensees with a supervisor status, as opposed to just simply LMFTSs? So is there any discussion y'all would like to have over that, or just I'll open up the floor for conversation?
Yeah, just one question. Are there for any of the other licensees, do they open it up for someone to be an instructor in the supervision course for all that? Is that opened up for other licensees? In other words, can an LMFT supervisor provide LPC supervision training or?
No, the LPC rules require it to be an LPC supervisor. Social work rules require it to be a social work supervisor.
Okay. So this would be
Mr.
just
Hyde?
consistent with that.
Mr. Hyde?
Yeah, it would be consistent. I guess the point I want to make is this rule is specifically talking about the 40-hour supervision course required to obtain supervisor status. And there isn't currently a standard in the rules. It just says take a 40-hour course, but it doesn't say that. So technically, according to the commenter, the LCSW could teach it, and there's nothing in the rules that would necessarily prohibit it. Now, this rule is modeled after the language that is essentially the same as what's in the LPC rules, and the LPC rules say it must be an LPC supervisor that provides those. So there's not and social work is adopting a similar rule modeled again after the LPC rule, making it specific that it's the supervisor under that, a supervisor, a licensee with supervisor status under that particular board. So right now, there wouldn't be anything wrong with it, but once we adopt this rule, then it wouldn't, the LCSW wouldn't do it. So I guess that's the distinction I want to make is it's really only been being done because LPC was the only one that actually had a standard that we could point people to. And so that's why we copied it and we made it specific to that particular license type.
Sarah, can you scroll down a little bit? I want to read the rest of the requirements, if you don't mind. Okay, other discussion?
Madam Chair, Chaplain Stogland, I understand what our attorney is saying, and I understand what the author of this proposal is saying. We have, as a board, gone through other people who, dealt with persons who thought because they taught the course, they have been involved with students who were seeking their masters in LMFT, that they should be given, I guess, a rite of passage automatically. My concern is that if someone starts doing that and other fields at this point are not doing it, requiring only their persons from their particular field to do it, I don't want to impose, if I could, Dr. Barti, and say, you can do this because you are not an LMFT, which he is, and a supervisor. And so then they start interfering or thinking that they could come in our field automatically because of that. And that's my strongest hesitation in approving something like this. I know that there are outlying areas, and I'll just say like El Paso area or some of the other western parts of the great state of Texas that may not have an abundance of supervisors, but because of technology, they can do it through that means. So that's my greatest concerns with that. With those comments, I'll yield.
Reverend Dr. Skoma?
Yes, I have, as a public member, and you can help me with some of my ignorance on this. It's my understanding that being a supervisor is not necessarily the highest goal for every MFT counselor. You might not feel called to that dynamic. So, but if you don't want to be a supervisor and yet you want to be able to teach this course, what would be the negatives of that? What would be the reason for restricting it just to supervisors? I understand there needs to be some kind of criterion, but would there be other criterion that would equal the level of what a supervisor does in this specific case for this class?
I mean, I think I would be, so I do think that it needs to be limited to supervisors, because those are the people, because if somebody needs to have supervision experience, I think in order to be able to teach the class on supervision. So I definitely think that whoever teaches that course ought to be a supervisor. When I look at the course content, I would probably be comfortable, because a lot of this stuff is more like about supervision in general, as opposed to specific to MFT. So I personally would be okay with an LMSW or an LPC as long as they are a supervisor status. I think I'd personally be okay with them teaching this course, but that's just my opinion. I don't know if anybody else on the board has that same opinion or not. But I do think that it needs to be a supervisor of some sort. But I'm curious what the rest of y'all think.
I agree with that, because I think the course content is pretty much just educational. It's a didactic. It's a course. You're not necessarily instructing somebody in how to supervise somebody in a specifically systemic methodology. What this is preparing the mind of somebody who is going to take that supervisory role. And so I think as long as it is a licensed supervisor in Texas, that would qualify them to teach the fundamentals of how to supervise. And it's not limited or restricted to specifically MFT criteria, because I think supervision is a domain, and then what we do, systemic supervision, is specific, and then professional counseling or whatever it's going to be, that's fine. So I'm open to modifying number one, M1, to the course must be taught by a licensed supervisor or a licensed supervisor status issued by the council or something like that, but
Maybe a
kind of
li-
not restricted to marriage and family therapist supervisor.
So just a
And I-
license, maybe a licensee with supervisor status. Dr. Elder?
I absolutely concur with the stipulation that it be a master's level supervisor. I think that would be something that would be important for me to have in there. A master's level licensee with supervisor status.
That makes sense because there are
I like it.
Yeah, me too. Because there are
Mhm.
some LMSW, not LMSWs, but
Bachelor's
Um,
level social workers.
yeah,
Yes.
social national
Yeah.
level social workers.
Yeah.
So that, as I read that, that would mean that the holder of a LMSW with supervisor status or the holder of an LCSW, a clinical, could teach this course.
Correct.
Correct.
But just to be clear, I think it's fine that someone who has supervisor status in any mental health license could teach the supervision course. But I still think that the supervision of LMFT associates needs to be done by an LMFT supervisor. I don't think that we should
Correct.
yield on that.
Correct. Yes.
Okay.
Mr. Hyde?
Yeah, I'm not necessarily advocating one way or the other, but I would suggest if you're going to make this change, we basically have it mirror what's in the continuing education rule. It sounds like that's the way you're going, so you could use the same wording, which I believe is kind of what you're saying, which is, shoot, I had it right in front of me.
A graduate level?
I think that's what, yeah, a graduate level licensee with supervisor status. And then it looks like similar to what's in another rule.
Yeah, because we've talked about this before, or not this specifically,
similar.
but we've talked about using that make sure that there is a master's level with that. Yeah.
Any further
I like it.
discussion?
Yes,
Chaplain
Madam Chair.
Collins?
Yes, Madam Chair. As long as, I don't know, and you know what, if it's specifically, you know, Dr. Bartia and others are comfortable with that, that's fine with me. And I think they have articulated clearly some of the reservations. And you're right, Dr. Bartia, we have discussed this in some other areas. What I would suggest is that we would make it clear that that doesn't mean whoever is teaching this supervisory course, and I may be over paranoid about it, but I want to make certain that they are not getting a free pass into becoming an LMFT supervisor or an LMFT practitioner. I want that to be very clear. And Dr. Bartia, I don't know if we could do that now or later on, draft something and submit it. So Madam Chair, to make certain that we don't have to deal with this as a board in the future, saying, well, I taught it for 3 years and I thought I would automatically be an MLFT. No, you're not.
Yes, I believe that
Right.
it's clear in our rules around what it takes to become a supervisor, but Mr. or Attorney Hyde, can you maybe offer comment?
Yes, I think that's very clear. I think it's, Sarah, correct me if I'm wrong, it's 801.142, right? Where it specifically says it has to be, you know, only can provide services under the supervision of an LMFT supervisor. So I'm looking for it right now, but I'm fairly certain it's in that rule. So if we already have it specific in the rule, that I don't think this rule will expand that and will authorize people to do that. I think the other rules make it clear that only an LMFT supervisor can supervise the provision of services by an associate.
Well, if I could, Attorney Hyde, could we put that in parentheses so that they automatically know that and the supervisor and the supervisee will understand that that's what it means, just supervision training rather than them doing something else. I know that may be overdoing it a bit, but I think if we just or maybe reference the paragraph. Does that make sense what I'm asking?
I think it does. I don't know exactly how we would word it to make it not too awkward. And I know my general like sense in doing something like that is it's not, you know, when we try to write a rule to basically make sure people don't misinterpret it, overread it, and we put way too many examples or explanations, it just gets, it's not an
Cluttered.
effective rule writing scheme, I think. And so I'm hesitant to say that that's going to be helpful or accomplish the goal, which that I think you're looking for, because I don't know, it's not typically how the rule writing is done. And so it's going to, I would need some time to like try to craft that to make that work. And I don't know if it would be a good thing to do that.
I'll just yield by saying that, you know, if you need some time to write that, or either just reference the paragraph or further information about this or the difference or something like that, that's fine. But I just wanted to make that a matter of record that we are at least trying our best to clarify the differences between LMFT supervision and teaching supervision, the course. Okay.
Dr. Barty, Dr. Elder, did one of you have a comment?
Yeah, I would just say that, Sarah, Sarah, if you flip back that again, because I do think there's a difference between training supervisors and being a supervisor of associates. And 80143 talks about the supervision of associates. And if you look at B, if you highlight B there, Sarah, that 40-hour continuing, I'm sorry, capital letter B, 1B, A1B, yeah, that 40-hour continuing education course, that's kind of what we're talking about right now, is how do they get that 40-hour continuing education course in clinical supervision? And who is eligible to teach that or to be the instructor of that? And in our what we're looking at in for this topic in 801.143 M, where is it? M1, the course must be taught by a licensed marriage and family therapist. What we're saying is, well, no, it does, to teach the course for supervision, it doesn't need to, we don't need to limit it to a MFT supervisor to teach the course, but we are limiting the supervision of LMFT associates to someone who is licensed as an LMFT supervisor. And the way they get that is they take this course, and the course can then be taught by any graduate level licensed supervisor of any mental health discipline in Texas. So I think it's clear
It's gonna be clear,
with
yeah.
that.
Okay, thank you, Dr. Barty. Chaplain Stoglen, did you have something else? I couldn't, okay. Then is there any further discussion about this agenda item? Yes, Dr. Elder.
I just have a question. What's the process from here, since this is probably a substantial change? What happens with this rule now moving forward?
That was going to be my next question too. Does this have to go back through public comment, or is this just a small enough change that we can go ahead and push it through to BHEC?
Well, you can repropose if you want, but I don't, since this isn't making it easier to comply with the rule. This isn't basically making it more restrictive, affecting it's responsive directly to a comment, and it's basically
Broadening.
the rule, right? Then thank you. Then I think this is something that could be adopted with changes. I think that's permissible, but of course you can repropose if you want to do it, but I don't think it's necessary in this instance.
If it's not necessary, then let's not. So may I get, is there anybody who would like to make a motion to, okay, I see Chaplain Stoglen. Chaplain Stoglen makes the motion. Reverend Pastor Skoma, Reverend Dr. Skoma is second. Is there any further discussion?
I would just like to ask that somehow this trickle back to the other boards who have equivalent rules that are adopting these rules to say, hey, MFT board did this. Can you consider this? Since consistency is the goal, maybe this needs to go back to the standardization workforce.
Could we clearly state the motion? I think I understood it, but I don't think it was ever stated. What is the motion?
To add graduate, how did you have that worded?
To replace the licensed marriage and family therapist with graduate level therapist holding supervisor status, I believe is what it was.
So the motion is to recommend to the council this rule with changes as discussed?
Yes.
Yes.
Okay, that's what I was trying to get to.
Yeah.
Thank you.
Daryl, I saw that you unmuted for a moment. Did you have a comment?
I was just gonna say, Dr. Elder, don't worry, we will make sure to relay or rub it in to the other boards that y'all have now expanded. That point will be driven home thoroughly.
Yes, sir.
Sounds
Thank
great.
you. Okay, all those in favor, please raise your hand. Okay, that is unanimous.
Thank you.
Okay, moving on to agenda item number, where are we?
13.
13A. So new text and changes to supervised clinical experience requirements and conditions to allow doctoral program students to count supervised experience hours towards their licensure requirements. Did we have any public comment on this? I don't remember now.
There was one comment not precisely on the rule changes proposed, but again, advocating that the 500 maximum for technology assisted services be repealed.
Yes, sir. Yes, that's correct. Okay, is there any discussion over 13A regarding allowing doctoral students to count their hours?
I'm in
Dr. Elder?
favor. Yeah, I'm in favor of it. I don't see any problem with the rule as proposed. Are we discussing the public comment? Or are we not there yet?
We can discuss the public comment on that, but there wasn't really a whole lot of public comment on it. There was just a public comment about the 500 hours.
And on the 500 hours, my stance is that we already allow a third of the direct clinical services to be counted through technology assisted services. And I think that adds great flexibility for licensees to learn how to work in that modality if they choose to. But I still think the majority of our hours, or at least that other 2/3, need to be in person.
I agree with you, Dr. Elder.
Agreed.
Okay. Any further discussion? If not, I will need a motion for us to propose, wait, Ms. Vassold.
I have a question for Attorney Hyde. It looks to me like the rule, sorry, I lost my notes. In 9B as in boy, strikes the word with. So if the changes are accepted as proposed, it reads in accordance, section 882 of this title, and I wonder if it should be in accordance with. Also in subsection 10, it uses the phrase of this rule, where in other places we've used of this section or of this title. And I'm wondering if of this rule has the same clarity and if that's a technical correction that is appropriate.
Yeah, I think the with was an accidental strike through. I don't think that was intended, and so I think there's no problem when we go back to adopt it. I think we already changed it in the materials going to the council, so I think that's corrected. The of this rule or of this section or those sorts of things, those it depends on what there's register format, there's formatting required by the Texas Register for referencing other rules. And so whatever the correct formatting is, we'll definitely get with the register and we'll correct them if there is anything wrong with it. I'm trying to pull up the exact rule where you're citing to it, but if there's any issues with it, we'll try to comply exactly with whatever the register requires. So, and those are clearly, non-substantive changes that we sometimes have to correct because the register says they have to be this way or whatever. And so we'll submit them that way. So we'll check those, but before they get published.
Thank you.
I just know sometimes it's supposed to be a certain way, sometimes it's not supposed to. And so it'll be we're going through all of their requirements. It'll be a long process.
Yeah, and Sarah, I talked with Jill and it's really based on that individual that's reading that rule, the editor. So, yay.
Okay, thank you.
Well, then may I have a motion to accept the proposed changes to 801.142 with any needed technical corrections? Okay, that is I saw Russ make the motion. I saw Chaplain Stoglen make the second. Sorry, Daniel, I'll get you on the next one. Okay, is there any further discussion? Okay, all those in favor, raise your hand. Okay, that is unanimous. Okay, let's move on then to 13B, which is changes to 801.202, the LMFT associate license, to alter the terms, the LMFT associate license, so that it is valid for 5 years, that it may not be renewed and does not require continuing education. We did have one public comment not in favor of this change. So I'm going to open the floor now to the board for comment. Reverend
as a
Pastor
public-
Skoma?
As a public member, could you just describe what are we trying to accomplish with this? I don't know enough about associate work to, what are the issues we're trying to correct or those kind of things?
Patrick, did you want to comment?
Sure, just real briefly. So, and Tim can correct me on the numbers because they didn't hire me for my math skills here, but he ran some data, and since 2018, 80% has completed the required supervised experience within 3 years, and then 98% has completed it within 4 years. And so the LPC associate licensure structure is a 5-year term license where it's non-renewable, and they get it once for 5 years. If they don't finish their hours, they just apply and get a new 5-year term license and finish it. This is looking to streamline that process because the staff has issues where this associate license expires after 72 months. And so you get so many renewals until then. And so there's a lot of calculation going into, okay, well, is this a valid renewal, or are they renewing it past 72 months? And then there's an exception to the 72 months that gets it to 96 months, but then they can't do it after that. And so did they meet the exception for that? And so it gets too convoluted, and we're talking about maybe 2% of all the associates that we're having to do. This is streamlining the process, and it actually is cheaper for the associates because they don't have to pay a renewal fee. So that's what this is about.
I will also add that currently in our rules, associates are required to renew at least once. And so again, that increases the financial burden. And I know that there are people, like I've known associates who are basically just waiting to renew their license so they can get fully licensed. And so again, this just kind of takes the burden off of staff, it takes the burden off of associates. And so.
It sounds like that addresses the concern that the public comment Mr. Morris had about the data. And it seems like the data is, it's significantly, it's an insignificant burden on 2%. Thank you.
Tim, I noticed that you're unmuted. Did you have a comment?
No, I was just unmuted in case I was called upon.
Okay, thank you, Mr. Spear.
Yeah.
Okay, any further discussion about this agenda item?
I'd like to
Okay.
move its
For the
adoption.
board-
Sorry.
Ms. Bashold.
For the board members' consideration, I noticed that in subsections A, B, and C, it uses 60 months, 60-month time period, 60-month licensure term, where we often just, as we're speaking about it, call it a 5-year term. And I'm wondering if that's easier to understand 5 years, and whether that upsets some scheme of legislation that we have to use the month rather than the year timeframe. And I'll defer to Attorney
That's a
Patrick.
great catch. Because I agree with you. 5 years makes sense. 60 months, I got to pull out some calculators. And so legally, is there any issue with that, Patrick? Do we have to?
Well, I mean, even my math is bad, but you just divide by 12. So it's a 5.
Hey,
it's not
Don't
bad.
pick on history majors. That's not what we're here for.
I believe the language is modeled after how the LPC rule works or the LPC associate rule works. And Tim or Daryl, I don't know if you know exactly why it was chosen 60 months as opposed to 5. The reasoning the reasoning that I can remember is we're borrowing from a system that works in the LPC associate. So we've taken their language, and usually as attorneys, if the language has worked before, if it ain't broke, we don't try to fix it.
Don't reinvent the wheel. Just go with what you got, because we know it works over on the LPC side.
So I'd like to move then that we adopt this change.
Okay, Chaplain Stoglen is a second. All those in favor, raise your hand. Okay, that passes unanimously. Okay, let's move on to 13C. This is to add a hospital or hospital system, including any clinic, et cetera, to the requirements for continuing education. This was basically brought about because it was kind of an oversight when we left it out. And so we're just adding it back in to make sure that it gets included. I don't believe there's any public comment on this one.
There was
As what?
there was one comment to keep the continuing education for associates.
Okay.
And I'll just have to say, completely in agreement with that. I was not in favor of removing the CE requirements for associates. I understand that supervision is, they're under supervision, so they're weekly in case consultation. But I think case consultation, in my mind, is a different experience than continuing education. And I really appreciate Dr. Stokes' comment that, hey, they're in private practice now. So I really think requiring them to get some CEs is fair game.
I
was-
agree with that. I think that's one of the distinctive features of the LMFT associate and the LPC associate, of which I supervise both. The LPC associates could not practice as independently as LMFTs, and that's CEs with that. LPCs. I like the idea that if they're out there practicing more independently, even though under supervision, that continuing education is an expectation. And I would, I'm a fan of keeping that requirement in there.
I have a question, but I see that Mr. Hyde has his hand raised. So do you want to make a comment before I ask my question?
Well, I don't want to cut you off, Chair. I just wanted to address what their comments covered. So it's your choice. I'll mute and you can talk first.
Well, maybe I'll ask my question because it could be that you answer my question you might answer my question after I ask it. I am curious that if we did decide to keep so if we move to the 5-year renewal period for associates, how then would we do continuing education? Would we create just like over their 5 years, they just have to get 30 hours or they have to get 15 hours over that whole 5 years? Like, I guess with the new structure, I'm not sure how we would what continuing education would even look like.
Yeah, that's exactly what I was going to talk about. So what that new rule that we just discussed for the associate license does is it doesn't renew. It's issued for 5 years. And then if they don't finish their supervised experience, then they have to apply and get a new license. And so continuing education is a requirement to renew a license. And so if they're not going to renew the license, there's no mechanism, there's no way to impose a requirement that they complete continuing education for the renewal of that license because they're not renewing it. So that's where you can't have one, you can't do one and then the other. Like you have to do both. Essentially, you pretty much have to do away with the continuing education requirement because you're now making this a 5-year non-renewable license.
Right. So it would not renew, it would upgrade. And you have 5 years to upgrade your license to full
Right.
licensure.
And then once you have the license, then yes, you're going to have to do the continuing education. And that is exactly the way the LPC associate license works, I believe as well.
Yeah.
Okay, let me hear from Mr. Spear and then from Reverend Dr. Skoma.
Thank you, Chair. Just two things. I want the board to keep in mind that we get almost 0 complaints on associates. The other thing I want you to consider is continuing education specifically is about people who are well past their education period. These are the folks that are the closest to their education period. So the changes that happen over time, they should have caught in the education itself. So I just want to point out that the need for continuing education is more on the existing practitioner than the newbie that's coming in.
That's a good point. Thank you, Mr. Spear. Reverend Dr. Skoma?
I was going to say, they're going to get plenty of classwork and those kind of things while they're pursuing their license. But back to the issue at hand, because we've got a little bit far afield, we're not changing the dynamics of it other than to add this hospital piece, which I would point out that back in the pre-BHEC days, when we actually met in physical presence, we had this discussion and I proposed this dynamic and it didn't pass, but this was on the list of those groups that would be acceptable, would be hospitals. So since the very beginning, in my mind anyway, this just makes sense that it would be a part of the deal. So I would move that we make this needed change.
Okay, yes, sir. Mr. Spinks?
Yeah, kind of piggybacking off of what Tim said. Tim said we get no complaints on associates. And I would also add that on the LPC side, where they have the 5-year license, they have the same independent practice authority, or they can own their own practice just like your associates can. It's basically the same scope, same everything that your folks have. The data just does not support the need for any kind of continuing education on the associate. It's just not there. There's not any data to support that. So I would just point that out.
Thank you, Mr. Spinks.
I like being evidence-based.
Any further discussion? Okay, then may I have a motion, please, to either accept or amend or just,
I think Mr. Parrish is going to make a motion to accept.
okay. Okay, is that, you're muted, so is that a motion to accept?
It is a motion to accept, but I thought Dr. Scoma was actually just said that he made the motion to accept it. in his
Okay.
comment. But I'll
Okay, so
second that.
Okay, so Reverend Pastor Scoma, or Reverend Dr. Scoma, he is making a motion.
It's
to
not
accept-
like we get paid by the motions or
I
second.
know,
I'm not
I
keeping
know.
score.
But you did say that. That's just.
I did say it, but it doesn't matter.
Okay.
Give it to Daniel. That's fine.
Okay. And then Mr. Parrish seconds. Any further
Yes.
discussion?
I just want to add really quickly, just to say publicly to those who might be listening, that I very much appreciate the active engagement from the public. These public comments make us think, make us reconsider.
Yeah.
And I really, really appreciate that we did receive public comments on the proposed rule changes.
Yes. Thank you, Dr. Elder. Okay, all those in favor of accepting this amendment, raise your hand. Okay, that is unanimous. Okay, moving on to item number 14, discussion and possible action regarding the jurisprudence exam. Is there any discussion over the jurisprudence exam? Dr. Elder.
So I'm noting one of the comments that said it would be helpful to have an easier way to access rules, something that is searchable by term and would pull up all of the applicable rules. So consolidated rule book, anyone? So I'm just wondering if we could maybe add a link to the consolidated rule books during that JP process somehow, so they can go be more aware that that resource is available.
We currently have a survey question that says, do you know how to access the rules? And right after that question, before they can even answer it, is a link to our statute and rules webpage. And we still have one or two who answer that question as, no, I don't know how to get to the laws and rules. So
Should be an automatic denial.
yeah.
Okay, just curious. Thank
It's
you.
like the old write your name in the upper left-hand corner of the paper. We're going to count off points if you put it in the right-hand corner. It's so, I'm looking at it right now. It's so clear. Yeah.
Yeah.
But
But
Hey.
thank you.
Well, I will.
And granted, I am sympathetic. We here, we go there often. I mean, we click. We're there all the time. So it's like, it's there. But for those every other year, every couple of years, when they have to go through, they don't always do that as frequently. And so they're going, where is this? And what does this do? So I'm sympathetic to the navigation aspect of it, because for us, it's a no-brainer. But for people that don't do it as often, I get that. But I do think that it is very clear on the site to be able to access it. And I think with a little bit of due diligence on the part of the person that is taking that, they can find it without too much effort. I really like the rule book. I like the way it's accessed. I think that's primo. That's brilliant.
Agreed, 100%.
Mr. Spear?
Yeah, just quickly, several of you are in academia. Do you know if the professional development course covers the website at all? or any of that kind of stuff? Because it sure would be good to.
Mine, I do. I teach well, I don't teach the ethics course anymore as of this year, but every year I've taught it. My students have a quiz where they have to find the website on their own, and then they have to go find like
Great.
it's like an open book quiz. They have to go and find a bunch of information on the website so that they get familiar with it while they are a student.
Okay, and then lastly, a shout out to Brenda for her work on those consolidated rule books.
Yes,
Yes,
for sure.
yes. Bravo, bravo, bravo.
I do have a follow-up question. I noticed there was another comment about I was surprised there's no information on the No Surprise Act. And so I know that's federal legislation that's outside of our jurisdiction. Is there anything added to our website, maybe in the Q&A about No Surprise Act, so that we can kind of heighten licensees' awareness of that requirement?
To my knowledge, we do not have that information on our website. I'll defer to the attorneys and Daryl and maybe Mr. Spear about how far into federal jurisdiction we want to extend our resources.
HIPAA and IDEA is about as far as I want to go into the federal law.
I'm sorry, what did you say, Daryl? How far do you want to go?
HIPAA and IDEA.
Okay.
I don't really like going much further than that.
Dr.
I
Elder, I
think-
saw that comment. I would give you a chance to inform some board members what the No Surprise Act is, because I don't know what that is.
So
Well,
I'll do my best. The No Surprise Act is federal legislation that was enacted in 2022, but became basically you must comply as of January 1st, 2023. And it's intended to protect consumers of physical and mental health services by saying, here is an estimate of what the services will cost you. And as a provider, you have to be within a certain margin of error around that number so that you can't surprise people with charges later. So as mental health professionals for our practices, we have to create what's called a good faith estimate, which is based on what I know of you and our work together, here's what the services could potentially cost. And it really only applies to people who are, for us, who are cash pay, not insurance. But it is a requirement. You have to provide it at the first contact with the client, and then you have to provide it at the intake. And there's a lot of belly aching among practitioners about implementing this.
Where are the teeth to that? Because obviously we're not going to enforce it with your license. So where does it get enforced? IRS or what?
It's a federal, it's the federal government. It originated with hospital billing is what it was. Complaints from hospitals that were overcharging and that there was not any real recourse for patients to gripe about overcharging in hospitalization. So legislature came through and says, okay, if you're providing any type of medical care, then you need to provide a good faith estimate, which says if you're going to be billing more than $400, you need to inform the patient of what that is. Well, there's an implication to us because we're under the big umbrella of medical care within the community. And the big issue is that in the medical community, there is a per charge per procedure fee. Appendectomy is this much, anesthesiology is this much, hospital is this much, and those are kind of set. And it's kind of a one and done. With our industry, it's ongoing. And so it's a little vague and confusing as to how do we come up with an estimate on how many sessions we're going to be dealing with somebody that has anxiety disorders or depressive disorders or things like that. Regardless of that, there is the requirement that we have to, as professionals, we have to adhere to that. And there are a lot of webinars and trainings out there that educate clinicians on how to do that. I think that's not anything that we need to, I don't think, be mindful of, because that has to do with, are they meeting federal requirements as a private clinician? That's not necessarily dealing with what we need to provide from the board perspective.
I agree with that, Russ. I'm just curious. So, but still on the federal level, who would enforce that with you? Is there
The Office of I think this is under the Office of Civil Rights. I'm not sure. Don't quote me on that. but there is federal teeth to it that if you do charge more than $400, there's a phone number or there's a site that's part of that. And I just can't think of who that is off, but it is at the federal level.
But they couldn't come after your license, just your wallet, basically, is that?
Well, the thing is, it's like HIPAA. If I violate a HIPAA rule, then the feds are going to ding me.
Right.
But there's a trickle down that comes down to the state licenses, because the state licensing boards kind of keep their ear to the ground for HIPAA violations and those type of things. So there can be a trickle down influence at the licensing area. But if we violate a federal regulation, then we're answerable to the feds. And if the state wants to follow up with that as well, then that would be up to the state.
So that comes back around then. So the question is then, does
It
this No
usually
Surprise
does.
Act trickle down to us as a board? And then it does become something we might want to be communicating.
Would
Well,
we,
I
would
don't
that,
know. I don't know if it's a board. I think that would be from the Attorney General, or that would be Patrick. You know, you could probably speak to if there's a federal HIPAA violation. How does a state what's the ramification for a licensee if there's a HIPAA violation that trickles down from the feds?
So if there's a disclosure of confidential information which would violate HIPAA, that would also violate Chapter 611 of the Texas Health and Safety Code. So we would cite them for a Texas statutory violation, which also the rules cite back to as well.
but I don't know that there's,
So the rules that require a marriage and family therapist to inform a potential client about services and office hours and all of that consent information. If their violation of the No Surprise Act also violated a current Texas rule, then this board would have authority over that conduct. If it somehow sliced and only violated the federal rule, but we couldn't construe it to violate a Texas rule or a Texas statute, then it's not that they wouldn't have any, to my mind, it's not that they wouldn't have any consequences in their local licensure. For example, I suspect that federal violations are reported to the National Practitioner Data Bank like our state violations are, and insurance companies would keep track of that and premiums would go up. So I think there's some clause in the mix there.
Madam Chair, and real quickly, I think Dr. Barti framed it outstanding for lay people to understand exactly. He's correct. Started with the hospital, and the president's administration was very concerned about it, and they marched toward it. And then under this administration, they and legislators, they voted on the No Surprise Act because bedpans are $430. Well, how can a bedpan be $430? Well, they charge you that. Well, how do I get this off? You can't get it off. And so, as Dr. Barti has clearly laid out the plan, and I think that's why Mr. Spink said, oh gosh, I'll just say HIPAA because we get into the weeds, but for public knowledge, there's a history. It's for the public, the greater public good. And one of the agencies that might be monitoring the situation would be Health and Human Services, or because it covers so much medical and mental and all, although there's another separate federal agency. But I think altogether it's for the bottom line is for the greater good on behalf of the public, so that you won't be charged $435 for a bedpan that may cost $10. And there's nothing you can do about it. Well, guess what? You now can. And that's part of the patient's Bill of Rights and so forth. So I think that by us discussing, having a healthy discussion of this, and Pastor Skoma raising the questions, and then Dr. Barti clearly articulating the framework, I think now whoever's listening or go back and listen to this recording of our board meeting today will get a clear understanding of what the No Surprise Act is. And so I think it's good. And as practitioners, and even public members, but specifically practitioners, it's just accountability. All it is accountability. you charge, this is why, and so forth and so on. So I'll yield with that.
Okay. Thank you so much, Chaplain Stocklin. Let me hear from Dr. Barty and then from Mr. Spinks.
Yeah, and as far as what's our obligation as a licensing board, we encourage, we require our licensees to be compliant with HIPAA, with high tech, with federal regulations, but we do not necessarily provide training for HIPAA compliancy and high tech compliancy. And I think this falls into that same category. So if it circles back down to the original question, do we need to educate our people on the good faith estimate and the No Surprises Act? Not any more than we would about HIPAA compliance or high tech compliance.
Mr. Spinks?
You know, one of the reasons I'm always hesitant to list any kind of federal law or put any kind of set of guidelines on the website about a federal law is because we're not in charge of or responsible for interpreting that law. So whatever we say, if it doesn't correspond or it doesn't match up with what HHSC, OCR says, we've now dropped our folks in the jackpot. And so I'm real. That's why if you look on our website, you don't see anything about HIPAA. You don't even see anything about IDEA. We don't interpret those on there for that reason, is because it's not our job to administer or interpret those. Does it come back to us? Yeah, I mean, Patrick Scoma, it does. I mean, it could, but you just got to be real careful there because you're playing in somebody else's sandbox once you start trying to give guidelines there. Now, I think if you wanted to do something in this arena, I think probably one of the better ways to do it would be like a newsletter article. Let me tell you the reason I say that. It's sometimes it's easier to put caveats on that, and they also just kind of have a natural life expectancy, an inherent life expectancy. They're easier to pull off. I don't know. I just something to think about. I can tell you I'm not well versed enough in the No Surprises Act to write a newsletter article on it, but that is an option if you all wanted to go that way.
Thank you,
I
Mr.
just see that there could be a potential public professional conflict over an issue like this, which are rare, I think, among our board dynamics. But I'm not saying anybody. I'm just saying I could see where the professional side would say, "Oh, brother, not one more thing we've got to deal with," whereas the public side is saying, "Well, the reason we want you to deal with this is because we don't feel protected when we go into billing cycle dynamics." So I'm not proposing anything right now that let's get a state version of no. We're not doing that. I just want to be clear. I could see where this issue could become not one of those things where as a public member, I just have to defer to what the professional side was saying. Does that make sense?
Yeah, it does to me. I will say, I think there are some corresponding or some parallel state laws to this. But I don't know if they just apply to hospitals. I remember, I think it was last session or session, this was a pretty big issue, surprise billing by hospitals. And I want to say that one of those bills, I cannot for the life of me remember which one, but I want to say some of this may already be covered in state law as well. But I've slept too many times since last session, so I just couldn't tell you.
Well, I know in our rules as a board, part of the element of informed consent, one of those elements is we must inform clients about our fee structure. And so it should be in everyone's informed consent already. The GFE, the good faith estimate, is just an added layer to making sure that clients know what to expect and that we're not going to add any surprises.
And that it is in compliance with federal regulations and that. I do know that there are across the nation, there's a groundswell of therapists that are saying, can we petition the government for an exemption from this because of the way we do business is not necessarily the way that hospitals do business. And so I think that would be something to keep our eyes and ears on as to if that has any legs.
I will add this and then I'll shut up. For the members of the public that are watching, licensees, applicants, or just members of the public, I don't want anybody to walk away from this meeting worried about the council or this board jumping on anybody that may have been perceived to have not complied, in full spirit with the No Surprise Act, because I promise you, everybody at this agency, the board, the council, and all the staff, we all understand the inherent fluidity that is just part of the billing in this type of a practice. So much of what you bill on is not decided by you or your services, but by those whom you are serving. So we are well aware of that. So in making your good faith estimates, just take comfort in knowing that we're all aware of that. We are not monsters out looking to hunt you down and make a kill based on this new law. So just don't anybody freak out. We're not coming for your license. We're not the boogeyman here. We're going to be pretty understanding in this area.
Thank you, Mr. Spinks. Okay, any further discussion about agenda item number 14? My last comment will just be to thank Mrs. Fastholes for the way that she investigates, like when somebody has a complaint, like she goes and she investigates it. And so I appreciate your work on that, Sarah. Okay, then we will move on to agenda item number 15. That is the report from the board chair. That would be me, just concerning things that are happening. So first, I just want to address appointments. So there are 3 board members who are technically up for reappointment. We've already discussed Mr. Francis. His appointment ends technically on February 1st. He, because has already served 2 terms, he will not be serving again. Also up is Chaplain Stoglin. He, due to his ordination and his new commitments, he has decided not to seek reappointment. And so this also could be potentially his last board meeting with us. We, again, just like with Mr. Francis, we don't know when his appointment will happen. So it could be in the next couple of weeks, or it could be a year from now. Like, we're not sure, but there is the potential that this will be Chaplain Stoglin's last meeting with us. So Chaplain Stoglin, I have greatly appreciated your tenure on this board, your comments, your insight, just the things that you bring. And I just know that you are going to also be sorely missed. Anyways, we just really appreciate your service here. Does any other board member have anything they would like to add?
I would just add that I think one of the things that I will miss the most is the good Reverend Dr. Chaplain Stoglin's comments about always ending his comments with the great citizens of the great state of Texas.
Yes.
Amen.
So, let there be no doubt where his heart lies. Let there be no doubt where his mind wanders. We all know it's for the citizens of the great state of Texas. And thank you for keeping us constantly having that in front of us.
And I will echo that I think the legacy is, I think every board meeting for the next several decades is going to include the phrase,
The
to
great
the
state of Texas.
people of the great state of Texas. And so, in fact, I think that needs to be in statute, right? Can we, okay, sorry. No, we won't.
Chaplain
But,
Stoglin, we
much
came in,
appreciated.
I'm sorry. We came in together. We did our training together, and I can't believe you're already cycling off, and I'm going to miss you. And I don't know where I'm going to get my news about the goings on in Arlington now. How will I keep up with the great city of Arlington? But thank you for your service. And I'll just point out, as a minister, I think you would concur with this as well, that guys, none of us are promised another meeting. This could be any of our last meetings. So we'll take it as we get it. And as many more as we get with you, we'll enjoy, but understand that, yeah, time is always precious.
But also, I would just point out, thank you for your heart for veterans. I mean, you clearly bring that to the forefront. You clearly bring that to the table. And I think it's a much needed conversation that needs to be expanded. And so thank you for constantly keeping that on the minds of people too. Appreciate that very much.
Absolutely. Just to add briefly on top, echo what everybody else said, but your service and devotion in not only to this board, but in everything you do is so apparent and clear, and you make a great difference with every board that you touch.
Yes. Now, if you can just work on your enthusiasm a little bit more and your decisiveness just a little bit more assertive, just a little bit more, I think you're going to do well in life.
Well, thank you all. I appreciate your comments, and it is for the greater good of the citizens of the great state of Texas and our veterans. 1% of us, we joke with each other, but doggone it, when we get over there, wherever there is, we forget all of that. So there's only 1% of us who have served in uniform. And I will say, speaking of the city of Arlington, for those on the board and those who are listening in the greater state of our technical audience, the Medal of Honor Museum, the only one in the country, is going to be open in Arlington, Texas, August 2024. We hope to invite all of you, August 2024. It will be tight security. It will be the highest elected and military leaders of our country for that. And they will transfer all the 3,500 portraits, bios of the recipients of the highest medal in this country. So it will be a great day. So thank you all. It has been my pleasure to try my best to serve the citizens of the great state of Texas, and because that's what this is about. So I thank you, and I'll refrain from any comment, but thank you all for coming. Thank you for coming to Modern Nation. And for quick information, I will not serve a parish. I will be working in community engagement for the Diocese of Fort Worth of the Anglican Church, of North America. So thank you all. It has been a high honor for me to serve on this board, and to know that we together have served practitioners, public members, etc. And then we were some of the main pushers and advocates for BHEC. I mean, this made the great state of Texas a bellwether state when it comes to mental health. We are way ahead of other states doing this. And I think by the leadership of our director and Sarah and Tim and all the other staff members, and I think Miss Brenda, who I've not met in person yet, thanks to COVID, we have made this board and BHEC what it is today. So thank you for your dedication and your service to the citizens and veterans of the great state of Texas.
Thank you so much, Reverend Doctor, thank you so much, Chaplain Stocklin. Okay, so going on from there, because we are having some, again, oh, I'm sorry, let me just say the third person who is up for reappointment is actually myself. But I have asked to be reappointed. I do serve at the governor's pleasure, so I don't know. I mean, I hope that I'll be here, but again, I serve at his pleasure, so who knows what'll happen. Anyways, because we are having some shifts in our board members with, 2 potential board members rotating off, as well as Pastor Skoma moving into the BHEC role, there's going to be some shifting in our committee appointments. And so Sarah will be sending out a description of the different committee options. And so if you have a committee that you would like to serve on, please let me know, because there, again, probably over the next few months, I'll be shifting some of those committee assignments. Let's see here. Next, I have decided that I do think that it is in the best interest of the board for us to resume face-to-face meetings. So sorry, I feel like I'm kind of springing this on you guys, but our next board meeting will actually be face-to-face. It is going to be at the University of Mary Hardin Baylor. I chose that location because it is centrally located. I have also set the meeting time for 1 p.m. and I'm hoping that way we can drive down on Friday morning. We can do our meeting in the afternoon, and then we can all drive home. I think Mr. Parrish and Ms. Husband-Thompson are going to be the 2 with the longest drive. And so it's possible that they may decide to seek a hotel room on Thursday night. But again, I'm hoping that maybe it'll be late enough in the afternoon that y'all might be able to just drive up that morning, do our meeting, and then drive home that evening and not have to get a hotel room.
And that's Friday, April, I apologize.
April 14th.
Thank you.
The meeting will still be broadcast via Zoom so that the public can attend via Zoom. Board members will be the only ones meeting face-to-face. Ms. Fastholes and Mr. Hyde and Mr. Spear and Mr. Clark and Mr. Spinks, they may also join via Zoom, and same with Ms. Skiff, but the rest of the board members, we will be face-to-face. I do believe that Mary Hardin Baylor is going to provide some sort of lunch for us. So if you want to be there at 11:30, we will do kind of just a lunch to get to know each other a little bit better. I do want to say that one of the things that I absolutely miss about face-to-face meetings is just getting to connect with the board members. That is how I got to know Miss Elder, or Dr. Elder. It's how I got to know, Mr. Francis, Miss Fastholes. Like, it was just being able for us to all be in a room together and conversing and just getting to know each other as people. And I do think that that's an important, I do think it's important for the board for us to be able to have that kind of connection. So yes, Dr. Barty.
Will that also be simulcast, or is it just will it be recorded and then uploaded later, or?
It'll be very similar to how we do it now. So yes, it will be simulcast via Zoom so that the public can attend either in person at Mary Hardin Baylor, or they can attend via Zoom. And it'll be recorded and all the things like we normally do.
Excellent. Thank you.
Pastor Skoma.
So I've been in favor of this, obviously, and keep bringing it up. So I'm excited about it. With the potential of maybe asking to have the cake and eat it too, would there still be the potential for board members to participate via Zoom? This summer I'm on sabbatical and I'm going to be in Sicily, and I was thinking, well, I could Zoom in from Sicily. Is this going to mean, no, I just need to miss? Is that the option?
Let me talk it over with, let me think about it and talk it over.
Okay.
It's possible that, yes, it might mean that you just need to miss. And honestly, if you're in Sicily, I'm not sure that you need to be focused on what's happening in the great state of Texas. I think you should maybe enjoy your time in Sicily, but
Yeah, I'm going to be there like 2 months. So I'll be bored out of my mind. I want to.
or we can meet in Sicily. Can we all go to
We could
Sicily?
have our meeting in Sicily.
Daryl was there. It might be for that.
Veto.
Where's the voucher that we?
What would be the travel budget ramifications, Daryl, of
I can get you over there, but you're probably on your own getting back.
sending a quorum over?
But I would like to, again, I just do want to be mindful of the fact that the board, we all are in different places of the state. And so I would maybe for us to be putting on our thinking caps of places where we could meet that might be centrally located, so that we could do it in this way where we can all drive to someplace, have the meeting, and all drive home without having to, do hotel rooms and things. I do want to decrease the burden on board members as much as possible. Abilene Christian, we are always open to serving and to hosting, but the problem is Abilene is a long way away for many of you. It's not too bad for Dallas. It's not too bad for Austin, but Mr. Parrish and Ms. Husband-Thompson, like, that's a 6-hour drive for them. So, you're in Dallas?
Fort Worth.
Yes.
Fort Worth could be open. Texas Wesleyan, we could.
Would you be willing?
Oh yeah, totally.
Well, then would you maybe be willing to consider maybe doing the July meeting?
Yes.
Okay. And I'm gonna put y'all.
I'll work on making that happen. Put that in pencil, and
Put that in pencil.
I'll talk with everybody. Mhm.
Okay. For some reason, I don't know, Daniel. For some reason, I thought you were in Houston. I don't know why I thought that.
Oh, no. That's what's in. Mary Hardin Baylor definitely is not far, and Abilene same.
Okay. Yeah. Okay. Then maybe is Miss Husband-Thompson is in Houston, right? Is she our only Houstonian?
Mhm.
Okay. See, this is why we need to be meeting in person, so I can get to know you. So I know this information.
Okay.
Can I ask about the status of Austin facilities? Daryl, where are we on that? I know that was in process, but.
Yeah, we still don't know.
Okay.
We're just waiting on the tech guys to get the cameras and everything. The rooms are set up. I don't know what the holdup is.
Will that be in that building where Attorney Hyde is now? The new?
Yes, sir. Yeah, it'll be here in the new building.
By the way, Attorney Hyde, you're triggering me. I lived in that building behind you, Jester Dorm, for a year, and I don't like looking at that over your shoulder. You move the camera more to the tower. That's an appealing thing.
The blinds are closed too. That's
Are they really?
Yeah. If I open
That's
them,
fascinating.
it'll be bright like Brenda's view.
Nice.
Wow. Okay. Okay, well, we will put together probably a list of locations for the next several meetings. So that to just be aware that we are going to do our best to move back to face-to-face meetings. Okay, I think that's all I have in my report. Let me just double check. We do have the TAMFT conferences coming up. And I haven't gotten word yet, but I assume that we will be presenting at the TAMFT conference in March. I do believe that Dr. Elder and Dr. Barty, was it you two who presented at TCA? Okay, yeah, y'all presented at TCA in November. And so anyways, I think that's all I have for my report. Any further discussion? Okay. Then let's move on to agenda item number 16, which is report from the board delegates to the BHEC Council.
Thank you. I'd like to take an opportunity to, we'll call it retweet, something that Director Spinks put out, which I thought was a really good piece of information. And probably because I love data and it was data driven. And as Dr. Barty says, evidence-based. And so that means a lot to me. But I thought it was worthwhile. And so Daryl and team had some really good numbers for the Q1 of FY23. 2,400 licenses were issued from BHEC over that time period. They renewed 7,000 licenses. They resolved 209 complaints. I know at this point, if I'm not mistaken, it's somewhere less than 400 complaints are still pending. The average processing time for pending applicants was 37 days, and the resolved complaints were within 288 days, with 60% of those being done within 6 months. These numbers are so much more improved than where they were than when we started. And the number of cases have come down significantly. And as Executive Director Spinks pointed out, this is done by a staff of less than 60 individuals. And so just absolutely amazing work. And as he said, I do believe things are gelling. I think they're working very well. And so I just wanted to take the opportunity with this brief report from the BHEC meeting to echo these numbers out to the team and make sure that everybody knows the good news there. Thank you, Madam Chair.
Okay, awesome. Thank you so much, Mr. Francis. I also was just blown away and so pleased by these numbers and just the progress that the staff have made, you know, given that they had a flooded building, they've moved buildings, they've been short-staffed. And so that they have been able to just become so efficient in such a short period of time with so many challenges. It's just spectacular. So big kudos to staff.
If I may add one more thing, and this is just a particular point of interest to me, that there are 80,000 licenses under regulation, 74,000 unique individual. So roughly 6,000 individuals have multiple licenses in the great state of Texas. I didn't realize that there were that many people that had multiple licenses. So that was kind of an interesting little factoid for me. That was it.
Okay. Dr. Elder? You're muted.
Thank you. I just want to echo everything that's been said about the wonderful work under BHEC and the staff leadership. I do also have a question. There was a report I had not seen before that I guess I need clarification on, which is the number of inquiries received. And so I guess I need some context to help understand the numbers in that report.
I would ask for some support for the answer on this one.
I believe you're referring to the report that Mr. Spear put together regarding legislative inquiries.
Oh,
yes,
it looks like that. Okay, I didn't realize that's legislative inquiries. Tell me more.
So when we have more of a backlog on complaints or licensing or responding to emails, et cetera, then people more often reach out to their legislators or the governor's office for assistance. Because they feel that we are not being as responsive as we should be. And Mr. Spear when we launched BHEC, Mr. Spear was fielding those types of inquiries. And the nature of how those have been reduced also reflects on the dedication and efficiency and the leadership that BHEC is doing what it was legislatively required to do, and we're better responsive to our constituencies.
That's amazing. These numbers are so drastically different from 2021 to 2022, and I think it's definitely a reflection of the efficiencies that have been put in place and are working so effectively.
And I think that might even be reflected in how many emails I get from licensees. I mean, like when we first made the switch to BHEC, I was getting like a couple a week. And I get maybe one every 3 months now. Like I can't even remember the last time that somebody has reached out to me. Like it just doesn't happen as often as it used to. So. Okay, any additional discussion regarding agenda items 16A or B? Okay, then we will move on to agenda item number 17, which is a report from our board administrator.
Thank you. I just want to share a bit with our website. This is at www.bhec.texas.gov. This is the landing page, the home page. And the links of the different member boards, the names of the different member boards are actually quick links, so you can get something specific to the Marriage and Family Therapy Board. I'll point out the statutes and rules page is where you can find those wonderful, easily searched, consolidated rule books. And thank you again to Ms. Skiff and her staff. If there were any, it might have been Ms. Skiff all alone. She has recently updated these rule books with the rules that became effective in November. So you can see on the date, on the cover of it, what date it was updated. So you know, if you've already downloaded it, you might want to download a new one, or just refer back to our website when you need to check the rules there. So I just wanted to bring that to your attention. Also, thank you to Mr. Spear under the frequently asked questions. Let me go back up here. He's added some new information, another scenario about if you're doing telehealth and whether or not you hold a Texas license, or if you only hold a Texas license, but your client is out of state, or you're a licensee from another state, but your client is moving to Texas, and all the different scenarios there. So those are at the top of the frequently asked questions. But recently he added information about how do I know if I'm under a CE audit? And he included very clear pictures. If you're under renewal, but not CE audit, you're getting this blue postcard. If you're under a CE audit, you're getting a letter. So it's very clear there what you need to be looking out for on that. If you've not updated your email, if you've not updated your contact information back at the council's homepage, there's a quick link to our how-to guides. And again, thank you to Mr. Spear for creating and maintaining all of these. There's how to change your name online. There's how to change your address. So it's incumbent upon the licensee to keep that information up to date. There's a rule that it states that it's the duty of the licensee to keep that contact information up to date through our database. So just wanted to point out that that's available to you there. Let me check my notes if there's anything else I wanted to bring to your attention.
While you're doing that, can I add that
Sure.
as somebody who has served on the ethics committee, updating your license or updating your address is so important, because if you get a complaint against your license, we are going to send it to the address that we have. And we have actually had licensees who have lost their license because they never responded to a complaint against their license because it went to the wrong address. So updating your address with the board is like incredibly important.
30 days. Is that correct? Yeah,
That is
30
correct.
days.
Within
to-
30
to
days of the
update that?
change.
See, I
Correct.
took the jurisprudence exam. I know these things.
I just reiterate, I think most people know, but if your license is coming up for renewal and you have not submitted a fingerprint for this agency, go ahead and do the online renewal. There's instructions in the online interaction on how to complete the fingerprint process so that our agency can access that data. And then we cannot renew the license until we have reviewed those fingerprint-based FBI and DPS reports. We do not mail a renewal card. You're to go check online the verification of your license. And if it says delinquent, then it's likely because we have not received your fingerprint reports. So keep that in mind. If you've renewed in the last several months and you're not sure if that renewal process actually was completed, you know you've paid your fee, but did you check that staff has completed the process and that you are renewed as active? If you're delinquent, then contact us by our Contact Us webpage and check it out. A lot of inquiries that I'm getting are ethical issues and legal dilemmas, and staff cannot assist you with that. You need to contact, if you have a practice issue, you consult with a experienced LMFT supervisor. If you have a legal issue, then please seek your own attorney to help you with those legal issues. I think that's it for my report, unless there's any questions I can answer for the board.
Madam Chair, pardon me. Go ahead. I'll yield, Madam Chair, if you have.
No, go ahead. Go ahead,
I
Chaplain.
want to just say to Sarah and to Tim that I just recently renewed my license, and everything Sarah talked about, particularly in her last frame of information, I had to get my fingerprints. I did that. And then it was saying, you know, receive fee, but holding pending fingerprints. And so it wasn't the LMFT staff, anything like that. It was timelined because the contract organization that did my fingerprints, they have to do it through DPS and blah, blah, blah. So there is a process, but they can track it, because once you are given a number, they can track that number. Once the number is tracked, everything comes together, then the licensure in this case was issued in a timely manner. So if anyone wants a quality assurance statement, that's it, that it did work, followed the rules, went online, and Sarah said everything. I won't reiterate all what she said, but what she just said, board members and to the general public, happened. And so if you follow the process and follow those processes and protocols, the system works. So I just want to attest to what Sarah said, and it does. So I want to applaud once again the staff for doing that, because I am a recent a recipient of all of what she just said. So I want to applaud you again and applaud the process. And I think when we talked about the rule book, to Miss Brenda's credit, you know, the rule book, what are the rule books? And as therapists, sometimes the tendency is here, is there, but now by consolidating all that data and using it as a dictionary, then you have a better opportunity for everyone involved. This whole series of conversations, from my perspective this morning, Madam Chair, has been extremely forward thinking, extremely organized, because it demonstrates that therapists can not only be sitting in the chair listening and hopefully providing some advice and all of that and guidance, but they know how to take care of the administrative, need I say that word, bureaucratic opportunities to take care of business. So I want to thank you for that. I'll yield with that.
Thank you, Chaplain Stoglin. Dr. Elder.
So just want to echo everything that Chaplain Stoglin said about how efficient the processes are, and just want to say, hopefully for public benefit, I know that the fingerprints have put a kink in things for licensees at times. However, keep in mind, you're one and done. You get that fingerprint once and you're finished for the length of your licensure. So it's just an initial hiccup that we're, it's changed. None of us like it. It's uncomfortable, but once you do it, you're finished. So I hopefully that provides some consolation.
Yes, and I'll just add that this is not the board's doing. This is not our rule. This is coming down from the Texas government. And so we don't, I don't know. I just know that there have been some complaints directed at staff, and it's not staff. It's we have no control over this. So we are just doing our best to implement the rules that have been created for us. So okay, any further discussion or questions for Ms. Fassel?
Just one more little advertisement for our website. Encouraging people, again, from our homepage, if you scroll down to the bottom, our Contact Us webpage, use that for the email form. And then also subscribe to our email updates so you know when rules are published. Whether you can look at the proposed rules and decide whether you want to make a public comment. You'll know when the meetings are and where they are. You fill out this form, you submit, click the submit button at the bottom. You'll get an email from this system, and then you'll need to confirm your subscription, and then you're subscribed. So I hope everyone will subscribe to that so you can stay informed with board actions and with operational updates when there might be another lunch, a webinar event, and those kinds of things. And that concludes my report.
Thank you. Okay, let's move on then to agenda item number 18, discussion and possible action regarding future priorities and activities of the board. Is there any future directions or activities that y'all would like to see the board engage in? Okay, hearing no discussion, we will move on to agenda item number 19, which is public comment, and I will turn that over to Sarah to facilitate.
Oh, sorry. Eesh, I'm trying to sneeze and not sneeze at the same time. So I believe there is no one attending in person at the Abilene location. Is that correct still?
That is correct still.
Okay, so we will next take any public comment from those who are attending via Zoom and ask them to use the raise hand feature that's on the Zoom account. After you've raised your hand, I'll click a button and allow you to unmute. I'll ask that you identify yourself and whether or not you are speaking as an individual or whether you are speaking on behalf of the organization, and identify the organization. All public comments will be limited to 3 minutes, and I'll ask Attorney Patrick if you would operate the timer. I appreciate that. I also wanted to bring to your attention that we have a new process, and I'm going to share my screen once more with the this is the second paragraph of the agenda, and there's a new way of providing written public comment. There's a link that's a part of the agenda and will be part of all future agendas that provides a link to MS form. So it's a web-based form where you can include any public comment that you'd like to in writing. The link is open from the time that we post the agenda on our website until 5 p.m. the day before the meeting, the last business day of the meeting. So you're welcome to use that feature if you'd like to, in addition to your verbal public comment that you give at the meeting. But if you'd like to provide written public comment, that's how you would do so. So I just wanted to make you aware of that. And with that, I will look at the attendees. Miss Sandra Martin, you have public comment.
Yes, can you hear me?
Yes, ma'am.
Okay, I'm Sandra Martin. I'm governmental liaison for Christian Counselors of Texas. And I just wanted to add my comment to our departing Chaplain Stogil. I never know how to pronounce your name, Stogil. Always appreciate the great state of Texas comments. I always leave a meeting after I've heard you make that comment feeling like I need to have a barbecue and a parade. So we will miss you on the screen and wish you the best in your future endeavors. And as for the whole board, thank you so much for serving us. We have differing among Christian Counselors of Texas. We have very differing opinions. We try to represent the Lord. That is our priority. We're not here to win a battle. We're here to represent the Lord. So thank you for your service. Good. And I'll see you at a public meeting. I'm so excited. Thank you.
Thank you, Ms. Martin. I see no other hands raised. Oh, wait. Yes, I do. Pamela Bermender.
Hello, can you hear me?
Yes.
Okay, great. I also wanted to add to what Ms. Martin had just shared from the CCT liaison government Governmental Liaison Committee. But I also want to express some appreciation as an LMFT licensee. I wanted to just thank you for the offering of the lunch and learn sessions, and please continue to offer those. Also want to express a great appreciation to each of the MFT board members for their commitment to understanding and distinguishing the MFT profession as a valid and valuable profession, while also balancing considerations regarding the BHEC scope and objectives for reasonable streamlining initiatives across the mental health professions. And also their dedication to protecting the public, the citizens of the great state of Texas. I am a native Texan, and I identify with what Chaplain Stoglin mentions in each meeting. Also want to express thank yous for both Mr. Francis and Chaplain Stoglin for their great service to the board and for our profession. And also wanted to express the appreciation for the consistently thorough and dedicated services of the staff, including the consolidated rule books and all that's being done on the website to help enable each of us as licensees to be able to provide the balance of our services to the great citizens of Texas, of the great state of Texas, while also trying to manage all the various, let's say, requirements that we have to keep up with at state and federal levels. So thank you again, and great appreciation to each of you.
Thank you, Ms. Bremender. Donald Gray, you have public comment?
Yes, I'm Donald Gray. I'm also here with the CCTX. Hello, Sandra. This is my first meeting, and I am just very excited to be in attendance and see how this process works. And I have to say also that I went through the renewal process last year in October, and it was so smooth and easy, the fingerprint part and everything. I was just amazed, because everything that the government does usually doesn't work the first time. But it did work. It was perfect. And that's it. I'm just happy to meet all you guys, and I hope to be in attendance at every meeting from now on.
Thank you, Mr. Gray. I see no other raised hands in the attendee list, and I see no phone numbers, so we do not appear to have any callers today. I believe that ends public comment.
Okay. I just want to just extend a thank you to our people who did make public comment, as well as to anybody else who is attending the meeting. We love having public engagement, and so we just appreciate y'all being here and being engaged with the governance of your license. Okay, let's see here. Agenda item number 20. Announcements and comments not requiring board action, such as statements regarding conferences and other recent or upcoming events. Is there anything that anybody has to say here for agenda item number 20?
Dr. Merchant, slightly off target, but I do think it's appropriate to thank you for such an efficiently run meeting. Time and time again, you keep us in order, you keep us in line, and you get the work of the great state of Texas done. So thank you for that.
Thank you very much, Mr. Francis. Okay, then, oh, Ms.
I was
Bassel.
just going to remind people that the council meets on January 31st. As Dr. Merchant mentions, TAMFT conference is in March. And then this board meets again on April 14th. And I'll leave it at that. Thank you.
Okay. Okay, is there any others? Oh, yes, Pastor Skoma.
I just wanted to thank Mr. Spinks for the reports. I know that's not our business, but the legislative track that he's tracking, I personally find very interesting. I know some of those things will affect us in the future. We're not lobbyists or anything like that, but thank you for those, Daryl, and keep them coming. And if you have any articles or things you want to send our way about that, I really appreciate it. So thanks.
I'll do it. I'll do it.
Okay, any other additional comments? Okay, then we will move to agenda item number 21, which is adjournment. Oh, wait. Chaplain Stoglin. Okay. Oh, he's making a motion. Okay. Do I have a motion for adjournment?
Wait. I would like to move that Chaplain Stoglen be given the opportunity to make the motion and Mr. Francis be given the opportunity to second the motion. I got
like
that's a
that.
movement. I was gonna say that.
I so move that we adjourn, Madam Chair.
And I so second.
Excellent. Okay. Any final discussion? All in
We'll miss
favor of
you guys.
adjourning?
Thank you.
Yes, you too. Trust me.
Exactly.
Thank you, gentlemen.
Okay.
Thank you so
Thank
much
you.
for your service.
Bye now, folks.
Okay, then our meeting is adjourned as of 10:57 a.m. Y'all have a wonderful rest of your day, and I guess I will hopefully see y'all in April.
Thank you, Madam Chair.
All right.
Bye now.
Bye-bye.
Bye-bye.